but we need to start understanding the power of AI. This AI can actually remove all those hallucinations, and you can speak some other things which is not relevant, but the entire system just captures all those relevant clinical records.
Welcome, Doc.
Hi.
Welcome to the first session of KoPiJom, the
Excited.
podcast series for KPJ. They chose to have the two board men for the first session. I'm not quite sure whether that's part of the selection criteria, but anyway, that's
It's
how
good.
it is.
It's good to show the work that we're doing in the digital health space.
So, what's your views on AI and generative AI, etc., in terms of that technology providing support to our clinicians in the field? Obviously, there's a range of AI solutions that can do some initial scanning of diagnostic images, etc. For example, we're using an AI tool in our radiology and screening in Johor Specialist Centre for lung cancer screening, and that's proving to be really successful. So there's a lot of opportunity for us to leverage technology. I think one of the other key challenges that we have is the healthcare workforce is quite strained, right? So there's always a lot of clinical duties to do, recording of patient results, etc. The opportunity to apply technology to alleviate some of those activities and free up the clinical staff for more meaningful tasks. So are you working on anything particularly within the Ministry of Health around that?
I think that's the future. The first thing that we need to explain, because healthcare workers, we're always trained to be perfect. We want, for patient safety, we need to ensure everything is in order, everything is correct, make sure we are always following regulations, rules, and whatnot. And we sometimes get a little bit disturbed when we introduce something very new, because we're very comfortable with status quo. But we need to start understanding the power of AI. I always give this example to all my colleagues. Those were the days when we did not need to have a personal assistant for us. Today, every single physicians they would have a personal assistant to just manage the schedule. And that's an assistant. So why don't we now take AI as an assistant? They're not going to replace whatever that you do, but they're going to just be there to augment whatever you do, whatever that you used to do, right? So as you said rightly, it's not new in the healthcare field. AI in radiology has been there from the early 2000s. And that is one of the most matured AI tool to augment radiologists' decision making. Can you imagine on how now you have got studies showing how important it is to have AI to assist your radiological readings, how it can reduce your time taken, how it can reduce your burden on reading multiple chest x-rays. So in Ministry of Health, we always do a lot of pilots. So now I think it's enough, right? Enough doing pilots. Solutions that has been proven to be effective should be adopted. I think that's the key challenge that we are having, and we are overcoming. So having change management within the healthcare system is so important, so crucial. But then again, looking at the new workforce which is coming in, they're all very pro tech. They're all very pro digital. You do have lots of physicians, surgeons now resorting to lots of tech, like robotic surgeries, and most of my primary healthcare clinics now have already started using clinical decision support. That's something remarkable. All those new clinics having EMR has got clinical decision support inbuilt within the EMR. So we are improving our health outcomes. So doctors are now, getting more used to them being prompted, if at all, any decisions need to be more precise for better patient outcomes. So if you ask me again, is MOH moving towards having tech or AI in healthcare? Definitive answer is yes. And I think it's the same for all private healthcare organizations. AI is very, very important.
Because I think that, AI obviously provides opportunities for us to drive efficiency in the way that we deliver healthcare services. But importantly, and probably most importantly, it actually provides the assistance for us to actually drive the quality of the care and the safety of the care as well. I mean, I think healthcare overall is a pretty safe industry in terms of the number of interactions that particularly the Ministry of Health would have every year, every day, etc. There's thousands of people, thousands of interactions happening every single day. But if we apply technology, a watchful eye or a support or assistance to a doctor, to a nurse, to an allied health professional, I think it's going to make that overall safety condition much, much better, right?
Precisely. And we have got many use cases where we have seen it helping using AI, not just clinical decision support, but automating our entire work process flow. We managed to reduce patient waiting times in most of our clinics by just identifying and automating certain redundant process. We managed to reduce headcounts in our counters. How, intelligent methodologies of registering patients and the system identifying his comorbids and putting him in respective consultation rooms, everything is instituted, and we are already seeing so much benefits.
There's a number of institutions, healthcare institutions, that are using facial recognition, palm prints, etc., to identify the patient. So removing the potential issues around identifying the wrong patient or maybe duplicating the patient record. So I think also technology has a profound effect in terms of the way that we store our data. A lot of the data, I think 80% of health-related data is unstructured data. Correct. So we can also use technology to assist us in structuring that data. Once it's structured, we can drive better data insights off that. Yep. So it's going to be a real game changer.
Of course. And you mentioned about how large language models, which is already there, how LLMs are now used to look into the data lake and, giving you much better insights, basically having unstructured data to beautiful insights. So even if you have your physicians putting in free text notes and whatnot, how these models can extract important information to give you much more better decisions, much more better insights.
Yeah, so funny you mentioned that. We're actually within KPJ, we're about to start a pilot project, AI-driven, essentially medical scribe. So we have the technology that will be sitting, listening to the doctor and the patient. Obviously, the patient will give consent. And then the medical scribe will essentially record the conversation, convert that to text, and then provide the context for the doctor to start doing the prescriptions, doing the principal diagnosis, etc., for that patient. So they can really focus on the patient.
Correct.
Rather than focus on the administrative tasks associated with healthcare.
True, because lots of doctors complain, do I actually speak to the patient or do I start typing whatever the patient says? And this new voice to text transcription is another very remarkable tech, which is now being very relevant. And I think it's really good to see KPJ adopting it. So how the doctor can just speak to the patient, and this AI can actually remove all those hallucinations, and you can speak some other things which is not relevant, but the entire system just captures all those relevant clinical records.
And also in Bahasa as well, right?
Any language.
So multi-language, compatible and capable.
I'm very envious now with KPJ embarking on this, and like us, of course, that's going to be one of the things that we would be deploying in the near future as well.